Ngā mihi nui kia koutou katoa. Warm greetings from Aotearoa, New Zealand. Haere mai and welcome to our presentation. I'm Franco Vaccarino. I'm from Massey University in the School of Communication, Journalism and Marketing based at our Manawatu campus.
Hi, my name is Andrew Oswin and I am a South advocate living in Christchurch. We'll be looking at a research project where South advocates conducted research on the experiences of people with Down syndrome during lockdown.
I'd like to introduce you to our team. So in the front row, we have Alex from Invercargill, Erin from Whangarei, and Caroline from Christchurch. In the middle row, we have Andrew from Christchurch, who's co-presenting today with us, and Duncan from Wellington, and Edward from Auckland. And in the back row, we have Avril, who's a national member of the New Zealand Down Syndrome Association. And then we have Zandra, who is the National Executive Officer of the New Zealand Down Syndrome Association. And I took the photo, so I'm not in the photo. The Self Advocates have been together since 2012. So this is a collaborative project between Massey University, the New Zealand Down Syndrome Association, and Strive. And that's the name of the self-advocacy group of the NZDSA.
As a team, we are co-designers, co-researchers, and co-authors.
So this research is an example of inclusive research where disabled and non-disabled people work together on research projects. A qualitative approach positioned within an inclusive research paradigm was employed in this study, in which a group of people with Down syndrome are co-designers, co-researchers, and co-authors. Walmsley in 2001 coined the term inclusive research to refer to research in which people with learning difficulties or disabilities who may have merely been seen as subjects of research are now research collaborators in the research design, the data collection, the analysis, and the dissemination of research findings. As you can see, 6 of our co-researchers in this research project are Strive members of the New Zealand Down Syndrome Association.
Strive is a team of self-advocates with Down syndrome who are national ambassadors and advocates for people with Down syndrome. We are also an advisory and leadership group of the New Zealand Down Syndrome Association.
So before we continue with this presentation, it's important to have a quick look at inclusive research. Now, over the years, there has been a growing body of literature describing inclusive research experiences. This draws on the social model of disability and has been significantly influenced by the People First movement with its motto of nothing about us without us. Inclusive research places emphasis on the fact that it must be the people with intellectual or learning difficulties or disabilities themselves who conduct the research on issues that are important to them. Furthermore, such an approach is also consistent with the principles of the United Nations Convention of the Rights of Persons with Disabilities. Walmsley and Johnson in 2003 pinpoint the characteristics and principles that underpin inclusive research. Firstly, the research problem must be one that is owned, not necessarily initiated by disabled people. We will see shortly that our COVID research project was in fact initiated by our Strive self-advocates. Secondly, it should further the interests of disabled people. Non-disabled researchers should be on the side of people with learning disabilities. It should be collaborative. People with learning disabilities should be involved in the process of doing the research. People with learning disabilities should be able to exert some control over process and outcomes. The research question, process, and reports must be accessible to people with learning disabilities. We believe that our research projects meet all these principles and are in fact inclusive. So a few years ago, the Strive self-advocates were looking for a new project to do. We started exploring the possibility of conducting some research. We had a number of workshops focusing on research, what research is, how to prepare surveys, how to conduct interviews, and understanding research ethics. Training on how to analyze data was purposefully not included in the initial research training. After all the interviews had been conducted, we had a training session on how to analyze these findings. Our first project focused on friendships. Strive generated some questions that they had wanted to ask other people with Down syndrome about friendships.
We prepared many questions to ask. We then chose the best ones and we prepared a questionnaire. We practiced our interviewing skills. After the training workshops, we interviewed people with Down syndrome in our communities. We sat for many hours examining the responses from our participants. This was really hard work.
So after our first research project, during a Zoom meeting with Zandra from the NZDSA, the Strive members said that they wanted to do a new research project. They initiated this research project as they were interested in the experiences of people with Down syndrome during the COVID-19 lockdown in New Zealand. Strive members brainstormed possible questions, which were then refined and finalized. It was decided to conduct face-to-face interviews using structured questionnaires. Soon after lockdown, when we were able to meet with others, and that's when Strive members conducted their interviews. We will be presenting some of the findings from this research in this presentation.
We interviewed 38 people with Down syndrome throughout New Zealand. 18 females and 20 males, aged between 18 and 41.
In the media and on social media, there is an abundance of information relating to COVID-19, and people can become overwhelmed by this information. However, it is important to have access to useful and pertinent information in order to reduce the spread of this infection. People with learning disabilities may rely on others to keep them informed, or they could access information on the internet or inaccessible, easy read formats that may be available.
In our survey, people got their information about COVID mainly from their families, television, and the internet. We asked our participants what COVID-19 is, and these are some responses. Our responses said that COVID-19 is a virus or a bug, and people get sick and can die. People develop symptoms and can end up in hospital where they are tested. It's a virus that attacks the lung system. As you can see, the participants are aware of what the virus is and that it is serious and people die. This shows that the participants were well informed about the virus.
In an effort to stay safe and remain at home during lockdown, our usual routines of seeing and visiting family and friends and work colleagues is put on hold. So many of the usual activities that people are engaged in had to shut down during lockdown. Sadly, during lockdown, millions of people around the world experienced loneliness, stress, frustration, and even anger.
Here is what our participants said about lockdown. We can see that our participants could not see their friends or family, could not go to work, and many activities that they were involved in had to stop. Some felt they were stuck at home, and one felt hopeless, and it was not fun. One lost their independence, and an artist said there was no school. So he cried and cried as he was very sad. We asked our participants what they liked about being in lockdown, and here are some examples that represent what people liked. There were many responses about cooking and baking with family, and of course sleeping, and was great for many participants. It is good to see that many participants continued exercising. Many participants spent a lot of time using technology, from listening to music, to watching movies, to Zoom meetings. One participant was very happy that she did not work but still got paid.
We asked participants how they stayed in touch with family and friends.
Most people stayed in touch with their family and friends by text, by phone, and by Zoom.
31 people used Zoom for meetings and activities, and 26 of these found Zoom easy to use. The New Zealand Down Syndrome Association has found these findings very valuable, particularly these that relating to the use of technology to stay in touch. So during subsequent lockdowns in New Zealand, the association has set up regular Zoom catch-ups and meetings, and these have proven to be very popular. People want to be connected and stay in touch with others.
We asked participants where they lived during lockdown. 31 lived in their usual place, while 7 did not live in their usual home. Most of them went back home to their parents.
In several parts of the world, people have had to work from home during lockdowns. And as the virus continues to spread, working from home has become a new norm, with people and workplaces adapting to alternative ways of working. With certain professions, there has been a shift from office buildings to home offices. During lockdowns, essential workers in the medical, pharmaceutical, and service industries, for example, have not been able to work from home, but have struggled with longer hours and shifts. Many disabled people work in service, retail, food preparation, and manufacturing sectors, which are among the most affected by COVID-19. Thus, for disabled people, there are additional challenges when transferring their workplaces to their homes, and in many cases, this is not possible. Also, the employment rate for disabled people before the pandemic was significantly lower than non-disabled people. Unfortunately, with the pandemic, disabled people have lost their jobs or have had their hours significantly reduced or face an uncertain future.
In our survey, 23 participants had jobs before lockdown. 3 participants worked during lockdown. 19 participants were able to return to their jobs after lockdown, and they were very happy. Whilst we were in lockdown, we received constant messages on how to get safe. This is what our participants said. The majority said that it's important to wash your hands to keep safe. This was a crucial message that the New Zealand government reinforced throughout lockdown, and our participants were aware of this message and implemented it. Other things that our participants did during lockdown to keep safe included sanitizing hands and groceries, cleaning services, wearing masks, keeping a 2-metre distance away from other people in their neighbourhoods, and staying in their bubbles.
An additional issue facing disabled people is that they may have been unable to receive the support and assistance they needed to ensure their general well-being, their independence and self-determination due to their carers or support buddies being ill or quarantined or not being able to continue to provide services.
35 people had to support. Only 3 people had limited support. Parents and siblings provided support. Some received a few phone calls.
We can see from this slide that people felt very differently about lockdown. They all coped, with 8 saying that it was awful and 5 saying that it was brilliant, and 1 even saying it was super brilliant. These findings suggest that this group of people with Down syndrome are resilient and adapted well to the lockdown situations.
People around the world can identify with a big smiley face when lockdown is finished. We asked our participants what some of the things were that they did after lockdown.
We can see on the left that connecting with others again after lockdown was very important. So we have participants seeing family again, seeing friends, seeing a boyfriend, and going out for coffee, spending time with flatmates, and holding a new nephew for the first time.
Returning to the usual things that people did before lockdown was important. So we see people going to the restaurant, the mall, the library, the movies, the hairdresser, and going out for lunch again. Our participants were also happy to return to Special Olympics, swimming, tempo bowling, going to the gym, dancing and acting, and drum lessons. Of course, they were also happy to return to work.
As an academic and co-researcher on these projects, I must say that this has been an amazing experience working with these wonderful self-advocates. They are awesome. We are now in the process of writing up our findings, and we're hoping to publish in an academic journal soon. And the self-advocates will, of course, be co-authors as well. Andrew, how did you find the research experience?
Franco, I really enjoyed learning how to do research how to create questions for the survey, how to conduct interviews, and how to work with the findings. Although at times there were difficulties finding participants, difficulties with transport regarding how to get to the interview and back, and some participants finding it hard to understand the questions. I think doing research is great.
Cool.
And finally, thank you very much for attending our presentation, and wherever you are in the world, please keep safe.
And as they say in Te Reo Māori, kia manawa nui, kia hau maru tātou. Let's stay strong and stay safe. Thank you. Kia ora.